Hello again, everyone. This is part two of our video series of the nurse making the transition from one other country into the United States. Coming into work as a nurse. All right, in the US. So in video number one, of course, be sure to check it out. And don't forget to hit your subscribe button, like the video, share the video, leave a comment. That's all right. All right, so we started a series and telling you when it comes down to the transitioning process, making that transition, migrating from one country to the United States, from another country to the United States, right? And we're particularly talking about the countries outside of Europe, all right? And I'm going to be walking you through the steps and the process. All right, so in video number one, of course, you can go and check it out and giving you the introduction as it relates to, how do you go about making that transition. All right, so in this video, I'm going to be, giving you my experience in making that transition and talking about some of these recruiting companies. And once again, from a legal standpoint, I am not being paid to promote any of these recruiting companies, nor any company that I am going to be mentioning in this video. All right, this is just a video that's purely for educational purposes, and it's just to help my colleagues as nurses all over the world, just to set you up as a guide, so that you can make life a lot easier for you when it comes on to this transition of transitioning from one country, from another country into the United States, to work as a nurse. All right, so it can be really daunting, can be culture shock and things like these. Moving from say paper chart to electronic, or moving from doing some things manually to doing them electronically. Even that in itself sometimes can be really frightening, or it can bring somewhat a certain amount of anxiety. All right, and so therefore, this is what I'm going to be assisting you in helping you to set yourself to make that transition. All right, so in video number one, we talk about the different types of facilities in terms of, ABC specialty facilities. Recruiters, guys, are usually looking for skill set. They're looking for experience. There's a shortage of nurses in the United States right now. There's shortage in Canada. Canada is a very big place, and the US end up with the shortage, because of the pandemic. There was shortage before the pandemic, but then the pandemic came and just made it worse. So if you're planning to, come to the United States and to migrate and to make the transition as a nurse from, your country into the United States, now these are the things that you want to consider. Now, first and foremost, there are many recruiting companies out there, and these recruiting companies, you can always check them out. All right, I'm familiar with a couple of them because I had to probably interface and went through and pick, choose, and refuse some of them. Not refuse them because there was anything wrong with them. It's just because when you have a marketplace, it's like you go into a supermarket to buy products, and there are a number of different brands in that supermarket. You just look at a brand, and you look at the brand, and you say, all right, I'll choose this brand. Not necessarily because one brand is really superior to the other. It could be that there's just one ingredient in one brand that you prefer over an ingredient in the other brand, because it could be that there's just something in one brand as an ingredient that doesn't sit too well with you, as well as there might be an ingredient in a particular brand that you prefer. So it is with these recruiting companies, just drawing that analogy, to say that you can always look at it, because there are many of them, and they are really looking to see how the best because they're looking for the best too. They're not just trying to just grab somebody because hospitals ask them, say, we're short, can you find somebody for us? Or they get a contract with different hospitals to supply them with nurses. When you look at all of this that is happening here, You go back in history and you see the same thing. It's just that it's just more modernized. The demands are different, the goods and services might be different, but the process is really the same. So these recruiting companies, they are out there and they're trying to see if they can get nurses into the United States to work and to place them in different hospitals. They look to see where the hospitals are short, and then of course provide them with good nurses. So they themselves also have to do a particular screening process just to make sure that they are taking up persons who are of integrity just the same. It's because they don't want to just grab any and anybody. So what is it that the recruiter is looking for? All right, so the recruiter looks for experience, and experience means the number of years that you're a nurse. So if you're just leaving school of nursing, and if you have 2 years experience under your belt, then sure enough, the recruiter is interested in you. If you have 1.5 year experience, the recruiter is also still interested. Why is the recruiter interested? Because by the time the process is all done, you're going to really end up with that 2 year experience. Or there are some recruiting companies or recruitment agencies that might take you when you have 6 month experience, but that's not that's kind of few and far between. That's kind of rare. The same thing with the hospitals. If the hospitals are doing their own recruiting, they will also look for skill set, and they will also look for certain year of experience. The minimum number of years of experience that they're really looking for is really 2 years. All right, so even though you might be in, say, the Philippines, you might be in some country in Africa, you might be in the Caribbean, or wherever it is that you are, you're watching this video, and it could be, like I said, you just want to leave for a different scenery. It probably might be economics. Whatever the reason, you want to know that 2 years of experience is really the minimum that most, and when I say most, of these recruiting companies look for. And there are recruiting companies that will not take you under 2 years experience. All right. O'Grady Payton is one of those recruiting companies, and O'Grady has been around for a long time, and they do pretty good. There is also Avant, and Avant has also been around. They have been around the block too, and so they also do pretty good. And there you have like Passports USA, which is another one, and they are also another recruiting company that is out there. And then also you have MedPro, and MedPro is also another recruiting company. So for those of you, in different countries, right? You come upon the name Avant, you come upon the name MedPro, you come upon the name O'Grady, you come upon the name Passport USA. All right, these are all recruiting companies out there that have been around the block, and they've been doing recruiting nurses here and there. They all have their stipulations, and those stipulations that they have is based on the immigration services, right? The USCIS, they also have to know their stipulations inside out. All right. So what's the first step when it comes on to the whole recruiting process? All right. So first and foremost, you want to have a license to practice in the country that you are. All right. So, and when you have a license to practice, you must also be in good standing with the Board of Nursing. All right. So you must be on that register of your Board of Nursing or the Nursing Council, whatever it is called in your territory or your country. All right. You must be in good standing with the board. There must not be anything against your name when it comes on to what it is that the board has on file for you, or what the council has on file for you. Your license should not be suspended, all right, or anything. There should not be anything against your license. That's what you want to make sure of, all right. Why? Because you see those 3 R's: registration, recognition, and reciprocity. That's pretty much what that is. How is that so? Because you see, when you're going to move from one country to the other country, all right, that board of nursing in that country is going to want to see, in terms of registration and recognition, reciprocity, at your board of nursing in your country to see whether or not you're in good standing with the board. Are you registered? Are you on the register? And what has been your conduct? Because they're going to want to see that too. So you want to make sure of that as well. And then, all right, so you want to have a nursing license with the board of nursing. You want to complete, all right, your nursing degree. All right, you want to complete your nursing degree, of course, in a reputable school of nursing. What is that reputable school of nursing? A reputable school of nursing is one that is accredited by the University Council and Council of Education, and it is also one that is also accredited by the Board of Nursing of that country. All right, so if the Board of Nursing of that country has not credited that school, does not recognize the school, then sure enough, I mean, obviously, then the board is not going to really have anybody from that school sit a council exam, which is really one that meets international standard. All right, so those are the things that you have to consider. Why do you consider this? Because when you're going to be moving guys to another country to practice, you see, the accrediting body, for example, in the United States, it is the CGFNS, and that is actually the accrediting body for foreign trained nurses. That is really that body that the National Council uses to assess the credentials of the nurse who is coming from a different country, the international nurse. So they use that accrediting body. For Canada, there are a number of different bodies that they use. They might use, the College of Ontario. They can do that kind of assessment. They can use, different more than one body that they can use to accredit that. But as Canada, when it comes on to the United States, and for a nurse who is moving into a different, from another country into the US, which is considered an international nurse, CGFNS, all right, they are the accrediting body that you're going to interface with. Okay, so you want to make sure that your nursing program that you are doing in your country is accredited. All right, so you don't just want to jump into a nursing program because you want to migrate or you want to get out of the country and go. And lo and behold, when you do spend all of that money, and by the time you're done the program and done the process and you're ready to move on, you realize that it is no good because they cannot be accredited, or it was not accredited, or it cannot be recognized as meeting the standard in the other country to which that you're moving, or it doesn't meet the standard in the United States based on their standard of nursing education. So you want to make sure that. So this is how good this video is, because it's also even giving you caution, even in your country where you are. And though I don't know you, but I'm talking to nurses out there, that it cautions you that if you're going to choose a school of nursing in your country to do a Bachelor of Science degrees nursing or a bachelorette degree in nursing, or a BSN as we call it for short, you want to make sure that that is an accredited school, not only accredited with the University Council of your country or the international university councils, but you also want to make sure that the board of nursing that governs nursing practice in your country also accredits and give it its nod. And so that way, the program is recognized, and when you sit that exam in your country, it is so when you are entered on the practice register, you are recognized in different countries, and that's where that recognition comes in, and that reciprocity and that registration comes in. You want to make sure of that program. So now, after all of this, all right, let's say you do your examination and you are successful in your examination, and then you want to look to practice. Now, this video, like I said, some people might say, well, it's going to somewhat prejudice some areas, but no, it does not. The reality is that you want to choose an area of med surge when you graduate. Why is doing med surge important? You see, medical surgical nursing is what I would say a chief pillar when it comes on to building a nursing practice. Oh, I know why is that so? Because when you graduate from a school of nursing, you want to head to acute care. When you head to acute care, you're able now to build on that. You get skills, all of these things that you read in nursing books and watch simulation videos, and so you want to get the skill. You want to get the hands-on. All right. So that when you get that hands-on, you can improve your skill. You know, Patricia Benner, she was one of those, when it comes on to nursing, both an educator and I would say a theorist as well. And she did a very good thing when it came on to ranking, nurses, looking at the progress that nurses made. And so she talks about, the novice. She talks about the beginner, the advanced beginner, the competent, and the expert. And so, when you start in med surge, perhaps as a novice, and then you want to go into being an advanced beginner, then you move into competent, you move into expert, and all of that. So that moves you from one level to the next. You will get these in other areas if you were to just settle down in those areas. But getting acute care experience is good. Why is that so? Because nurses who do not start in acute care, sometimes, and only sometimes, not all the time, sometimes they find it difficult to get into an acute care. Let's say they start out in community health nursing, as in, say, school nursing, or they started at the health center, the health clinic, or so. And then when it's to make the transition now into acute care, in some countries it's a little bit difficult, it's a little bit tedious. In some countries easier than others, depending. But it's always good when you just graduate from your school of nursing. You want to get yourself some acute care experience, some med surg experience, build on that, and move yourself even to a competent level. And so, of course, then you can move on to the expert level. So when you move yourself to that competent level, then you can go on to specialty areas. All right. You can switch over to different specialty areas that you want to switch over to. All right. But nonetheless, the recruiters, they're looking for, the nurses who have had a certain number of years of experience. And, starting in the acute care is where you want to go, or in the specialty area. If you want to go to pediatrics, you want to go to, let's say, maternity, because there's always going to be space for the maternity nurse, or psychiatric nurse. There's always going to be that specialty for psychiatric. Med surge is always going to be there. And then after that, of course, going into areas like critical care, emergency room nursing, or other areas, specialty oncology, nursing, cardiology, all the different areas, or branches that you can branch into. But starting with med surge gives you a good edge. It gives you a leverage. And, 2 years minimum experience is usually what a lot of the recruiters are looking for. All right. So, when you're ready to, say, start the process with the recruiter, all right, I'm going to give you two scenarios. Okay. One of them is going it on your own and doing your NCLEX, and the other is, going through the agency to do the NCLEX. Now, what's the advantage and what's the disadvantage? All right. All of this is information that you'd probably have to pay for, or people won't tell you. But look, how the recruiting system works is that they are spending a certain amount of money. All right. So whatever they do, they are spending the money. And that money that they are spending, they are actually, keeping a tab of it with their receipts and stuff like that. So here's what the recruiters do. One of two things. They can either roll that money back into your contract amount. So in other words, they look to see how much money they spent in getting you into the country. And then what they'll do is calculate that money back into hours. And so those hours go into the contract hours that you're going to do. All right. So that way you really don't have to pay them back anything. You just do the contract hours for the period that you signed the contract for. All right. That's one way they do it. Some will have you spend the money, and then they reimburse you, when you come into the country, or however the agreement goes. But most of them, once you sign up with the recruitment agency, recruits, or whether, like I said, there are a couple of them that I know, whether it's Avant, whether it's MedPro, whether it is O'Grady Payton, Passport USA, or whichever other ones are out there. All right. When you sign up with them, all right, they can say, we will take care of the expenditure. So we will send you the study material for the NCLEX. We will set up the Skype or the Zoom or the GoToMeeting platform. Most of them use the GoToMeeting platform. For the sessions, we will send you the test. We will allow you to go into Saunders or Pearson, or whichever of the software they're using, so that you can do all of that work and that practice, and so you can prep yourself and get yourself ready. But all of that costs money. And so those monies that the recruiter is spending on the nurse, to prep the nurse to pass the NCLEX, right? Somebody have to pay for that. That's not free. So the recruiter, like I said earlier, can calculate that money back into hours and roll it back into the contract, so that when you come to work, those are contract hours. You work that off, and so therefore they would have gotten all the money back. So all the hotel that they're going to put you up in that hotel, and whatever food and expenditures it is that they are spending, pick you up at the airport, if they are the ones that buy your plane ticket and tell you when you're supposed to show up at the airport, and all of these things, all of this is money. And so that money has to be accounted for. Most times it is really accounted for in them calculating it back into hours, rolling it back into the contract. All right. That's one of that, one side to it. The other side to it is that you can do your NCLEX by yourself before, contacting any of these recruiting companies. So you can go it alone, do the NCLEX, and of course, subsequent video, you will hear and see what the process is in sitting the NCLEX by yourself. I mean, once you have a valid visa, that's pretty much all you're going to want. That would have been probably the big hurdle. And even if you don't have a valid visa, when you go through the process of signing up for NCLEX, which I will detail in another video step by step for you, you go signing up for the NCLEX, and once you get that approval from the Board of Nursing to which you signed, or to which you registered, and you get that approved to test email that give you the link to go to Pearson VUE, and then to pay for the exam. And once Pearson VUE gives you that letter of approval, if you don't have a visa, you just when you apply for the visa, those are the two proof of thing that you're going to need at the embassy, so that they can say, okay, that's why you're going into the country, you're going to sit an exam. And most times, I mean, I can't recall, just probably very few times anybody have ever had any trouble with immigration, because these guys in immigration, they're experts. They know what is going on there, and all of the processes that goes on a day-to-day basis. So they know if you're trying to go around them, or if they have good reasons. But most times, from my experience and from what I've read, you go through. So that's when you don't have a visa. If you already have a visa, that's fine, because once you get the approved to test and you choose your exam date and location, then you come and you sit the exam. So you can do the NCLEX by yourself, and after you get the NCLEX, you pass that NCLEX exam, then you can turn to doing to a recruiter to say if you want to make the transition to work into the United States. Now, what's the advantage of doing the NCLEX by yourself versus the disadvantage. All right. So the advantage of doing the NCLEX by yourself is that you're spending your own money and you're doing it in your own pace of time. You're not rushed by the recruiter because they have a certain timeline to meet, and you are not feeling under any stress. So you're like moving at your own pace. So that anxiety and that stress is not there. And because you spend your money and your time, you're not going to be obligated to the recruiter for that time and energy that you spent doing the NCLEX, because it wasn't their time, it wasn't their energy, it wasn't their money. So that's one of the big advantage where that is concerned. And then now, when you say contact one of these recruiters and you want to get your money, in terms of your money's worth, contacting the recruiters, you will see how that pays off. How does that pay off? When you have your NCLEX already and you contact one of these recruiters, guys, that time they can't roll into the contract, because now that will make the contract less of a time, and the spending and what it is that they require of you will be less. So your hours will be less. How is that so? Because the hours, they'll calculate how many hours you did spend preparing for your NCLEX and doing all of that. They kind of roll that off kind of a standard. Or they can reimburse you for the NCLEX that you already did and whatever money you spend for it. And then by doing that now, okay, now they are now free to set up their contract. But you don't have to take the reimbursement, because all you can say is, look, now the contract time is going to be less because I already did this by myself and I already paid my money and all of that. So, you don't have to consider that now in your contract hours. So whereas probably your contract would have been 3 years, maybe 2.5, 2 years might be what the contract is in terms of contract hours now, because a lot of time has been taken from it. And in terms of, reimbursement as it relates to monetary reimbursement, all of that is not going to be factored in this time. So that's one of the advantages of doing that NCLEX by yourself. Some persons go as far as, doing their visa screen and all these things by themselves. And so all of that takes out a whole chunk of time as it relates to the contract hours that you would do when you come to work for the recruiting company, and how many hours you'd have to do to fulfill the contract until you are, and then you are free from the contract. So all of that is, things that you consider. However, on the other hand, now when you do the NCLEX with the recruiting company or the recruiting agency, advantages, you have the material, and you probably might not need additional material if they are good. But most of the students that I have coached and prepped for NCLEX, sometimes they are already with a recruiter, but they still need extra help, because one of the disadvantages of the recruiter is that a recruiter is moving at a fast pace. And some nurses, depending on where you work and the type of exposure you have, might sometimes be a little bit slower to catch on, and being a little bit slower to catch on sometimes can that disadvantage. And then of course there are always those who on the platform that, sometimes they want to impress others, and they come across as being, so bright, and so they cloud you out and they make it look like you don't know anything. All right. They make it look like you don't know anything, boy. Look like you're not trying, or they look like you don't even know anything about nursing. Or so, and so sometimes you feel intimidated, and that intimidation, can sometimes cause you to somewhat, become a little bit despondent. So that's one of the other things that you think about. You might be working, and sometimes the recruiting agency might set up a go-to meeting, or if they use Zoom, whatever it is that they use, and you're not able to meet that because you're working, and so that pass you by, and so sometimes you feel stressed. You're trying to get a little sleep, but you're trying to meet the hours because all of this is time, and so and so. The other advantage, though, of doing all the NCLEX by yourself without the recruiting agency is that if you go and you fail the NCLEX, the plain fare that you would have paid and all of these monies that you have spent, it's really on you. And so that's your stress, not theirs. So you don't have to feel obligated that you waste your money And sometimes no, some of them allow you to sign a contract before. It's not the contract for the contract hours coming in the United States to do the work or so. That's a different contract. But some, of course, will have you sign a contract before. And that contract is really going to be stating, what it is that they're doing, and the cost is on you if it is that you, haven't lived up to your obligation. So if you decide to pull out, because you can't take the stress or something turn around in family or family issues or something death in the family, and you can't continue, then because if you're doing it by yourself, then you won't have that stress. If you're doing it with them and you want to pull out, the contract might state that you need to pay them back what they have actually pay them back what they have actually spent already. And so that's another thing that you have to bear in mind when it comes on to the advantage of doing the NCLEX by yourself versus doing it with the recruiting agency. All right, all of this, guys, is valuable, deep information that you're not going to get anywhere. Nobody is really going to take the time out to tell you all of this. All right, and that's why you need to subscribe to the channel, like the videos, comment if you need a comment, and of course you share it and all of this, because there are many nurses out there right now who wants to make the transition, don't know the first step, don't know what are the things that you want to think about when it comes on to the transition, or migrating right from there to the US to work as a nurse. All right, so those are the advantage in terms of the recruiter, doing the NCLEX by yourself versus doing that with them. So those are the advantages and the disadvantages that I lay out. Another disadvantage when it comes on to the recruiter is that sometimes they might give you what we call an assessment or a diagnostic test, or a pre-readiness test that sometimes can be a little bit daunting, a little bit stressful, whereby you're doing it by yourself. You go through, you get your exam date, and you go do the exam. So you don't have all that pre-readiness test and all that stress to deal with. All right, so that's that's an advantage in doing it by yourself. All right, the advantage with that, though, on the recruiter's side, and you see how balanced I am, on the recruiter's side, is that it does help you to see where you are, prep you, and it probably can save you time and money too, because if you're not meeting the mark in terms of the grade or the percentile that you should be on in that readiness test, it might be saying to you that you're not quite ready. You probably need more time to go and prep for the exam. So that's an advantage in doing that. So I've given you the balance, and that way, of course, it helps you to make an informed decision, because this is what nurses do. They give you accurate information so that you can make informed decision or informed choices. All right, so that's really what nursing is all about. All right, so that's the thing with when you talk about the recruiters, going with the recruiter to do the NCLEX versus doing the NCLEX by yourself, then contacting the recruiter. So now you have all of that information to play with. You definitely will know what it is that you want to do where that is concerned. All right, and now when it comes on to the other contracts, so remember that some recruiters, recruiting companies, agencies, you sign a contract the moment you go in and you put in the application, and one of the agents begin to talk to you. They begin to ask you how long you've been a nurse. They find out if you have the NCLEX already and what type of hospital you work, and they want to find out what are you exposed to as a nurse in terms of experience and practice and material and electronic equipment and all of that you have worked with. So right there, they start to set up a profile for you to see exactly where you are in terms of the best fit. They're also listening to how you answer them, how confident you are, how knowledgeable you are in terms of the way you respond, because that in itself will kind of tell them exactly where it is that they want to fit you, or they see where they can fit you. And sometimes right away you're talking to them and they might say to you, I think I have a place for you right away. Boy, you sound like who we are looking for to fit here or fit there. So all of that is also part of that part of it. So now, with the other contract, and that other contract that I'm talking about now is the one that seals the deal. So when does this contract come to fore? All right, so the contract, usually sometimes you end up signing the contract, and then signing it again when you get into the United States, because usually there are amendments and adjustments that's made. And so the clauses in there will tell you that, this, it's up to the discretion of the person who writes it. So they change that, and they tell you where you can sue and where you cannot sue, and in which state this contract is honored and in which state that contract is not honored. So all of these things are in there. Contracts on a whole, as you already know, is it is a document that really sets out an agreement between two parties, and provisions are made for compensation in that agreement should one party actually breach the agreement or not live up to their end of the agreement. And that's really what contracts are. I mean, if you read every contract, you will see what provisions are made for compensation. You will see what provisions are made for restitution if this one doesn't live up to their end or that one doesn't live up to their end, that kind of thing. So all of that. So these contracts, guy, and this contract, as I said, seal the deal. This is the one now that you're signing to. And in this contract, you're signing to rate per hour, you're signing to code of conduct that is in that, you're signing to what is expected of them, you're signing to what is expected of you. And if you read the contract and you realize that it is more to your disadvantage than to your advantage, that's not really a contract you want to sign, because you want the contract to be a balance. They get, you get. So you want it to be something balanced out. Yes, it's going to take the effort on your part, because you're the one who's going to be doing the work. You're the one who's going to be experiencing all the discomfort. And so this is why from the get-go, talking to your agency or the recruiting agency or the recruiting agency representative, you want to lay out who you are, what it is that you're looking for, what your preferences are and stuff. You might not always get your preference, but they'll work to see how best they can fit you in. And I can tell you this because I have gone through it. And so, I can actually tell you that they'll work to see how best they can fit you in. So I mean, like I said, legally speaking, I am not paid to promote any. And when I say any, I mean none whatsoever. I'm not paid to promote any recruiting companies or recruiting agencies. But having gone through, I can tell you what my experience is. And I can tell you right off the bat that these guys are not monsters. I tell you that based on my experience. They're not monsters. All right, there are people who you can work with. They're understandable. But you have to lay out from the get-go what it is that you're looking for, what it is that you want. This is the type of person you are. This is your capability, so on, so on. So, and from there, they look to see, as it relates to what it is. So you want to look at your contract carefully. Now, what I would say, amen, and I am not a lawyer. Let me just make that absolutely clear. We live in a legal-minded world. People listen to your videos and they try to find some form of iota or some legal piece that they can catch you on. So let me tell you that I am not a lawyer, but what I would say as a nurse to nurses out there, when these contracts come from these recruiters, have a lawyer look it over. Why? Because they are experts. They are very good at it, especially an immigration lawyer or an international lawyer, an immigration lawyer more so. Why? Because they know this is what they do. This is their area of expertise. And when you have a lawyer look that over, they can tell you what advantage this will be to you, what disadvantage this particular thing is to you. And so it doesn't hurt to pay a small fee to have a lawyer look over these things for you, walk you through it, and tell you all about it. But I can tell you that it's something you want to look at carefully before you put your signature on it. Even though you might be in desperation and you say, well, what's the worst can happen, that kind of thing. That's not the attitude you want to take as a nurse who wants to migrate or want to make the transition. You want to, have that piece set, because you're going to have other things of anxiety and other things to deal with. All right. And so in the next video, I'm going to be talking about, what is my experience And then I'm going to be telling you about, your budgeting to migrate as a nurse to make the transition. I'm going to give you some tips on budgeting. I'm going to give you some tips on, your preparation. I'm going to give you some tips on credit when it comes on to, your credit and your credit score in the United States. I'm going to give you some tips on that. I'm going to give you some tips on, practicing, how you approach the hospital facility, and of course how you deal with your recruiters when you come, the things that you want to say and the things that you don't want to say, because some things you say, it can work against you. All right, and so these things, like I said, nobody will tell you, but this is nursing practice made easy. This is really what this channel is for. Everything nursing. All right, be sure to check out the videos that are the other videos that are there. Like and subscribe and share. And until the next video, guys, I'll see you. Hope all of this information will help you along the way. Whether you're a seasoned nurse looking to migrate, or you're just graduated and want to know, you have migration in mind, you want to know what the next step is. This is your video. This is your channel, Nursing Practice Made Easy. My name is Patrick. I'm an RN, and I'll see you guys next time.